Listen up, RSV is on the rise. This is definitely something you need to be aware of, especially if you have babies or young children. So let's check in with Dr. Ryan Doster, a UofL Health physician specializing in infectious disease. First, let's talk a little bit more about RSV. What are some of the symptoms parents might notice?
Sure. So respiratory syncytial virus, or RSV, is a common virus that rotates kind of in the fall to winter along with the other viruses we think of like influenza and COVID. The symptoms really can range, and it's hard to tell them apart because all of them can range from a runny nose and mild cough to more severe infection, including full lung disease where the child might have a severe cough, difficulty breathing, or wheezing.
Okay, good to know. How about the number of cases you're seeing? Are you seeing more this year? What does this look like for Louisville?
So typically, RSV wouldn't start rotating in the community until November, but the last 2 years after COVID, we've actually been seeing this much earlier. And so we are starting to see our first uptick in cases, but we're not at full kind of alert level yet. But the U.S. Southeast is already there, and so we're probably not far behind.
So it's good to be talking about it now before
Absolutely.
we get there. So we appreciate that. Okay, most important question of the day here. What should parents be doing to keep their kids safe?
So unlike COVID and influenza, we actually don't have any medicines to treat RSV. So really this is all about prevention. So when your kids are sick, keep them home. If they do need to be around somebody who's coughing or ill, they may want to wear a mask. We want to wash our hands frequently and avoid touching our nose and our mouth, which is hard for kids. And especially for our youngest kids, those that are less than 9 months old, we actually have some new therapies, including monoclonal antibodies, that look very promising to prevent those most severe infections that might end a kid up in the hospital.
And is that something that parents should be reaching out to their physicians to ask about?
Yeah, so talk to your pediatrician, especially if your child is less than 9 months of age and going into their first RSV season. That's when this medicine seems to be most effective.
Wow. And is this the first season that we're going into where we have this tool?
That's correct, and we also have new vaccines approved for adults over 60 because we don't think about adults getting those infections, but certainly the kids can take them to the grandparents and make them sick as well.
It's a good heads up, and I really appreciate you coming here before it's terrible, so hopefully people are getting some good information.
Absolutely. It's all about prevention before the season gets started.
Yes, sir. Okay. Thank you so much, Doctor, for
Thank
coming
you.
on.